The Trump administration has directed organizations in other countries to stop distributing HIV medications that were purchased using US aid, even if the medications are already in local clinics. This move is part of a broader freeze on foreign aid announced the previous week, which includes the president's emergency plan for AIDS relief, a global health initiative originally launched by George W. Bush. PEPFAR is credited with saving over 25 million lives worldwide. As a result, appointments are being cancelled and patients are being turned away from clinics, according to sources familiar with the situation, who wish to remain anonymous due to fears of retribution. Many individuals living with HIV are experiencing sudden disruptions in their treatment. In addition to these disruptions, federal officials have been instructed not to communicate with external partners, which has caused confusion and anxiety, according to multiple sources. US officials have also been told to cease providing technical assistance to national health ministries. Asia Russell, the executive director of the advocacy group Health Gap, shared that the partners the US collaborates with are in a state of shock, unsure of how to proceed as they feel their life-saving missions and commitments have been compromised. On Sunday night, employees at the Centers for Disease Control and Prevention were informed via email that they should immediately stop communicating with personnel at the World Health Organization, WHO. They were further instructed not to share the same meeting space, whether in person or virtual, with WHO staff members, nor should they participate in email discussions involving WHO. Several individuals who requested anonymity out of fear of retaliation said they were too afraid to contact colleagues they considered friends, even to say goodbye. On Monday afternoon, officials around the world were notified that PEPFAR's data systems would shut down at 6 p.m. Eastern Time, roughly 3 hours after the initial email. This would block access to all datasets, reports, and analytical tools. An email seen by the New York Times advised users to prioritize saving key documents and data, sparking speculation that the program might not resume. The future of PEPFAR appeared uncertain at the time. PEPFAR has faced opposition from some Republican senators for years who have argued that the program indirectly promoted abortion. In March, the program was renewed for another year. However, the suspension of PEPFAR's activities is now raising concerns about the impact on individuals living with HIV. Without continued treatment, viral loads in those affected can rise rapidly, weakening the immune systems of those infected and increasing the likelihood of transmission. If treatment is interrupted, resistant strains of the virus may emerge and spread globally. One study predicted that if PEPFAR were to end, as many as 600,000 lives could be lost in South Africa over the next decade. In this country, PEPFAR contributes 20% of the HIV budget, and in other poorer nations, some are almost entirely dependent on the program. Gera Retvosyan, who served as Chief of Staff for PEPFAR during the Biden administration, stated that this freeze would have a devastating impact. Gera Retvosyan, who served as Chief of Staff for PEPFAR during the Biden administration, stated that this freeze would have a devastating impact, leaving countless lives in jeopardy.